Question 1. In ICD-10-CM coding, what convention is used to indicate that two conditions cannot occur together, so both codes should never be used on the same patient record? I. Code first. B. Excludes 2. C. Excludes 1. D. Use additional code. Answer C. Excludes 1. The concept tested here is one of the most critical ICD-10-CM conventions, which are essential instructional notes. The key phrase is cannot occur together, which points directly to the excludes 1 note. This note means not coded here. The excludes 1 note is used when two conditions are mutually exclusive, such as a congenital, present at birth, versus an acquired form of the same condition, meaning you would never report both codes for the same encounter. For example, if a code for a specific type of anemia includes an excludes 1 note for a different, mutually exclusive anemia, you must only report the appropriate code. Always follow the excludes 1 convention because it represents conditions that are anatomically, pathologically, or etiologically, causally, impossible to report together. Question 2. A patient is diagnosed with uncontrolled type 2 diabetes mellitus with diabetic polyneuropathy. How should these conditions be sequenced for ICD-10-CM coding? I. Code polyneuropathy first, then type 2 diabetes. B. Code type 2 diabetes with polyneuropathy first, then an additional code for the polyneuropathy if applicable. C. Code type 2 diabetes with polyneuropathy first, and no other codes are needed for the polyneuropathy. D. Code uncontrolled type 2 diabetes first, then a separate code for the polyneuropathy. Answer C. Code type 2 diabetes with polyneuropathy first, and no other codes are needed for the polyneuropathy. This question tests the guideline for coding diabetic conditions and the concept of combination codes. The combination code is the clue because it represents both the disease and its manifestation, and diabetic polyneuropathy is a common manifestation of diabetes. In ICD-10-CM, a single combination code is used whenever one exists to describe both the underlying condition, diabetes, and its manifestation, polyneuropathy, such as code E1142. Because the ICD-10-CM classification already provides a complete code for type 2 diabetes mellitus with polyneuropathy, separate codes for the diabetes and the polyneuropathy should not be reported. Always look for a combination code when coding diabetes, as it simplifies reporting and ensures the most specific code is captured. Question 3. A patient is seen for a pathological fracture of the left humerus due to senile osteoporosis. Which condition is sequenced as the principal diagnosis? I. The pathological fracture of the left humerus. B. Senile osteoporosis. C. Senile osteoporosis with current pathological fracture. D. The fracture code, followed by a code for senile osteoporosis. Answer C. Senile osteoporosis with current pathological fracture. The concept being tested is the proper sequencing and use of combination codes for conditions involving osteoporosis with a current pathological fracture. The key phrase, pathological fracture due to senile osteoporosis, indicates that the fracture is a manifestation of the underlying bone disease. ICD-10-CM guidelines direct the coder to use the combination codes within the M80 category, which identifies the type of osteoporosis and the presence of a current pathological fracture. The single code from category M80 includes all the necessary information, making it the principal diagnosis, and no separate code for the fracture or the underlying osteoporosis is needed. Always prioritize using a combination code for conditions like pathological fractures due to osteoporosis, as it correctly reports both the cause and the injury together. Question 4. In ICD-10-CM, what does the fourth character of an injury, poisoning, and external cause of morbidity code, Chapter 19, typically indicate? I. Specific location or severity. B. External cause of the injury. C. Healing status of the injury. D. Laterality, left or right. Answer I. Specific location or severity. This question addresses the structure of an ICD-10-CM code, specifically within the injury chapter, which is a major area of focus on coding exams. The fourth, fifth, and sixth characters provide clinical detail, and the fourth character often specifies the site or the severity of the injury. For instance, in codes for fractures, the fourth character often differentiates between the specific bone at G, shaft, head, neck, or the level of severity G, displaced versus non-displacity. Knowing the purpose of each character, such as the initial 3 defining the category, helps coders drill down to the most specific code. Remember that character positions beyond the third provide increasing clinical specificity, with the 4th through 6th characters defining details like location, type, and cause. Question 5. A patient is admitted to the hospital with acute systolic, congestive, heart failure. Which ICD-10 CM code category would be reported? I-10, B, I-50, C, I-25, D, R00, R99. Answer B, I-50. The concept tested here is the direct classification of the common diagnosis of heart failure within the ICD-10 CM tabular list. The keyword is heart failure, which is classified primarily in category I-50 heart failure. Codes in I-50 specify the type, such as systolic, I-52, diastolic, I-53, or combined, and the acuteness of the condition. Category I-10 is for essential, primary hypertension, and I-25 is for chronic ischemic heart disease, which are different conditions. When coding heart failure, always go directly to the I-50 category to select the most specific code that captures the acuteness and type, ensuring precise documentation of the patient's condition. Question 6. When coding a current fracture from the ICD-10 CM injury chapter, what is the significance of the 7th character, D? I. Initial encounter for a closed fracture. B. Subsequent encounter for routine healing. C. Sequela. Late effect. D. Subsequent encounter for a non-union fracture. Answer B. Subsequent encounter for routine healing. This question tests the coder's knowledge of the required 7th characters for the injury and poisoning chapters, which provide critical information about the encounter. The 7th character, D, always represents a subsequent encounter for a patient who is receiving routine care during the healing phase of a fracture. The keyword is the letter D itself, which is a mnemonic for during routine healing, as opposed to a for active treatment or S for sequela. For example, a patient returning for a cast check on a fracture that is healing well would use the D extension. Always remember the 3 main 7th characters. A for initial treatment, D for follow-up care during healing, and S for complications after the injury has healed. Question 7. A coder is trying to find the correct code for a mass in the left breast. The documentation is ambiguous as to whether the mass is malignant or benign. In the absence of definitive pathology, which type of code is most appropriate? I. A code for neoplasm of uncertain behavior. B. The code for primary malignant neoplasm of the breast. C. The code for benign neoplasm of the breast. D. A code for unspecified lump or mass of the breast. Answer D. A code for unspecified lump or mass of the breast. The concept being tested is the proper coding of signs and symptoms versus neoplasms when the diagnosis is not definitively established, which is a key ICD-10 CM general guideline. The keyword ambiguous and the lack of definitive pathology are the clues, indicating that the final diagnosis is not a confirmed neoplasm. If the provider documentation only lists a sign or symptom, such as a lump or mass, and does not confirm a diagnosis, the coder must report the code for the sign or symptom, R92-8 in this case, rather than assuming a neoplasm. For example, you would code R92-8 for an abnormal finding on a diagnostic imaging of the breast until a pathologist confirms whether it is benign or malignant. Do not code a diagnosis based on suspicion. Always code the highest level of certainty documented in the record. Question 8. What is the minimum number of characters required for a valid ICD-10 CM code? I. 3. B. 4. C. 5. D. 7. Answer I. 3. This question assesses the fundamental structure of the ICD-10 CM coding system. The basic structure requires a minimum of 3 characters to define the category of the condition. For example, the category code I-10 is for essential primary hypertension, and it is a valid code if no further character specificity is required or available in the documentation. However, most codes require a 4th, 5th, 6th, or even a 7th character to achieve the required level of clinical specificity and meet the highest level of detail guideline. Always start your code search at the 3-character category level and then add subsequent characters until you have the most specific and complete code possible. Question 9. A patient is being treated for the sequela of a fracture of the right ankle that occurred 2 years ago. How should the condition be coded? I. Code the current problem/sequela first, followed by the original injury code with a 7th character. B. Code the original injury with a 7th character first, followed by the code for the current problem/sequela. C. Code only the original injury with a 7th character. D. Code only the current problem/sequela, as the injury is no longer acute. Answer B. Code the original injury with a 7th character first, followed by the code for the current problem/sequela. This concept tests the specific sequencing rule for coding a sequela late effect, which is a condition that arises as a result of a previous injury or illness. The keyword sequela and the time frame of 2 years ago clue the coder to use the 7th character S, which signifies the late effect. The guideline requires 2 codes. The condition or nature of the sequela is sequenced second, and the code for the original injury or cause appended with the S character is sequenced first. For example, chronic pain from a healed ankle fracture would be coded first with the late effect fracture code S82851S, followed by the code for the chronic pain G8929. Always remember to report the cause of the sequela, indicated by the S7th character, before the manifestation of the sequela. Question 10. Which statement accurately describes the use of excludes 2 notes in ICD 10 SIM? I. The conditions listed should never be coded together. B. The conditions listed must be coded together. C. The condition excluded is not part of the condition represented by the code, but a patient may have both conditions at the same time. D. The code can only be used if the excluded condition is not documented. Answer C. The condition excluded is not part of the condition represented by the code, but a patient may have both conditions at the same time. This question tests the coder's ability to differentiate between the instructional notes excludes 1 and excludes 2. The key is understanding that excludes 2 means not included here, but it does not mean the 2 conditions are mutually exclusive, unlike excludes 1. This means that if the documentation supports both conditions, they can both be reported, as they are separate and distinct. For example, a patient may have code L38 other specified dermatitis and also have R21 rash and other nonspecific skin eruption, and both codes can be reported if the documentation warrants it. Think of excludes 2 as allowing the reporting of a secondary, coexisting diagnosis, meaning a patient can have both conditions simultaneously. Question 11. A 68-year-old male presents with urinary retention due to benign prostatic hypertrophy, BPH. Which ICD-10 CM code is sequenced as the principal diagnosis? I. Urinary retention code R33-8. B. BPH code N41. C. A combination code, if one exists, for BPH with lower urinary tract symptoms. D. Code the BPH first, followed by the urinary retention code. Answer D. Code the BPH first, followed by the urinary retention code. The concept here is the proper sequencing of multiple diagnoses when a symptom is due to a specific underlying disease, which is governed by the general guidelines. The keywords due to establish a cause and effect relationship between the BPH, the cause, and the urinary retention, the manifestation. When a manifestation is not implicitly covered by a combination code and the relationship is clearly documented, the underlying condition, BPH, N41 is sequenced as the principal diagnosis, followed by the manifestation, urinary retention, R33-8. For instance, in this scenario, the BPH is the reason for the encounter, and the urinary retention is a secondary problem caused by it. Always sequence the underlying etiology, cause, before the manifestation, symptom, when both are present and documented as related. Question 12. A patient is diagnosed with metastatic carcinoma of the bone. The primary site is documented as the lung. When coding the neoplasm, which code is sequenced first? I. The code for primary malignant neoplasm of the lung. B. The code for secondary malignant neoplasm of the bone. C. The code for carcinoma in situ of the lung. D. The code for neoplasm of uncertain behavior. Answer: I. The code for primary malignant neoplasm of the lung. This question tests a crucial guideline for coding neoplasms, specifically the sequencing of primary and secondary metastases sites. The guideline states that when the patient's encounter is for the treatment of the malignancy and the primary site is known, the primary malignant neoplasm, lung, C34, is coded first. The secondary site, bone, C7951, is then coded second to reflect the metastasis. For example, if a patient is undergoing chemotherapy for lung cancer that has spread to the bone, the lung cancer code is principal. Always remember, if treatment is focused on the cancer itself, the primary site code is sequenced first, followed by the secondary metastasis site code. Question 13. Which ICD-10 CM code category is used to report a patient's personal history of an allergic reaction to penicillin? I. T36, poisoning by penicillins. B. Z91, personal history of risk factors. C. Y40, adverse effects of penicillins. D. Z88, allergy status to drugs, medicaments, and biological substances. Answer: D. Z88, allergy status to drugs, medicaments, and biological substances. This question tests the correct application of Z codes, specifically those related to history and risk factors in the ICD-10 CM classification system. The key phrase, personal history of an allergic reaction, indicates that the patient is not currently suffering from an adverse effect or poisoning but has a known allergy status. Codes in category Z88 are used to report a patient's established allergy status, which is a crucial fact for safe medical treatment. For example, Z88-0 would be used for penicillin, alerting all providers to this specific drug allergy. When documenting historical allergies for patient safety, always use the Z88 codes, as they provide critical information that influences current care. Question 14. A patient is documented with chronic obstructive pulmonary disease, COD, with acute exacerbation. Which combination of codes is appropriate? I. Only the code for COPD, unspecified. B. Only the code for COPD with acute exacerbation. C. COPD with acute exacerbation code, followed by a code for the underlying COPD. D. Code for acute exacerbation, followed by the COPD code. Answer: B. Only the code for COPD with acute exacerbation. The concept tested is the use of combination codes, especially for chronic conditions that present with an acute flare-up. The keywords COPD with acute exacerbation direct the coder to the combination code in the J44 category. The ICD-10 CM guideline instructs coders to use the single combination code when a chronic condition has an acute exacerbation, as this one code completely describes the patient's condition. For example, code J44-1 includes both the chronic COPD and the acute exacerbation, so no other J44 code should be reported. Always choose the most comprehensive single code that fully describes the condition and its current state of acuteness. Question 15. The final character of an ICD-10 CM code often indicates I. The primary attending physician. B. The severity of the illness. C. The patient's laterality. D. The anatomical location, which is almost always the seventh character. Answer: C. The patient's laterality. This question focuses on a unique and mandatory aspect of the ICD-10 CM structure, the concept of laterality. Laterality specifies whether the condition affects the left side 1, the right side 2, or is bilateral 3, with codes for unspecified 0 or 9, when laterality is not documented. For many anatomical sites, laterality is a required character, often appearing as the fifth or sixth character, not the final one, to achieve maximum specificity. For example, a code for a fracture of the right tibia ends in a 1 or 2 to denote the side, not the severity. Always review the tabular list for the necessary laterality requirement to ensure the code is valid and complete. Question 16. What is the correct application of the ICD 10 cm guideline regarding reporting signs and symptoms? I. Signs and symptoms should always be coded when documented, regardless of the definitive diagnosis. B. Signs and symptoms are coded only when a definitive diagnosis has not been established by the provider. C. Signs and symptoms should only be coded if they are related to the definitive diagnosis. D. Signs and symptoms are never coded if a definitive diagnosis is known. Answer B. Signs and symptoms are coded only when a definitive diagnosis has not been established by the provider. This question tests the core ICD 10 cm guideline concerning the reporting of signs, symptoms, and ill-defined conditions. The key rule is that codes for signs and symptoms, or codes, are not to be used when a definitive diagnosis explaining the symptom is known. The exception is when the sign or symptom is unrelated to the definitive diagnosis, such as coding a cough, R05, alongside pneumonia, J18-9, if the cough is not a standard part of the pneumonia presentation. For example, a patient with chest pain, R079, who was later diagnosed with acute myocardial infarction, I21-9, would only have the I21-9 code reported. Only use a code for a sign or symptom when the physician has documented it without an underlying, confirmed diagnosis. Question 17. A patient is treated for acute cystitis. Upon review, the documentation notes the causative organism is Escherichia coli E. coli. How should this be coded? I. Code only the acute cystitis. B. Code the acute cystitis first, followed by an additional code for the E. coli infection. C. Code the E. coli infection first, followed by the acute cystitis. D. Use a combination code that includes both the infection and the organism. Answer B. Code the acute cystitis first, followed by an additional code for the E. coli infection. The concept here is the proper use of the use additional code note, particularly for infectious diseases where the organism is known. The instruction to use additional code is a mandatory guideline found in the tabular list under the code for acute cystitis. The code for the condition, acute cystitis, and 30 is sequenced first, and a code from the B95, B97 category, the organism, e.g., B96, 20 for E. coli, is sequenced second. For instance, N3000 followed by B96, 20 accurately reports the infection and its specific cause. Always follow the instructional note use additional code by sequencing the underlying condition first and the specified organism code second. Question 18. A patient is status post S/P a total knee replacement performed 1 year ago. The patient is currently being seen for routine postoperative follow-up and is healing well. Which code category is most appropriate for the principal diagnosis? I. Z96, presence of functional implants. B. Z47, orthopedic aftercare. C. T84, complications of internal prosthetic devices. D. M25, other joint disorders. Answer B. Z47, orthopedic aftercare. This question tests the understanding of aftercare Z codes and their appropriate application as the reason for the encounter. The keywords are status post, routine postoperative follow-up, and healing well, which indicate that the purpose of the visit is directed toward aftercare, not a complication or the presence of the device itself. Codes in category Z47, such as Z47-1 for aftercare following joint replacement surgery, are typically sequenced as the principal diagnosis when the sole reason for the visit is routine follow-up. Do not use complication codes, T codes, unless there is a problem. Instead, use the appropriate aftercare Z code for routine, uncomplicated follow-up. Question 19. When coding for an adverse effect of a properly administered medication, how should the codes be sequenced? I. Code the condition resulting from the adverse effect first, followed by the T code for the adverse effect. B. Code the T code for the adverse effect first, followed by the code for the condition resulting from the adverse effect. C. Code the T code for the adverse effect only. D. Code the condition resulting from the adverse effect only. Answer I. Code the condition resulting from the adverse effect first, followed by the T code for the adverse effect. This concept tests a key guideline for drug-related conditions, specifically the sequencing for an adverse effect of a drug that was correctly prescribed and properly administered. The rule is to sequence the nature of the adverse effect, the resulting condition, such as a rash or kidney failure, first, followed by the appropriate code from the T36, T50 category. For example, drug-induced hepatitis would be coded first with the hepatitis code, K71-0, and then the T code identifying the substance causing the adverse effect, T46-0X5I. Remember to code the manifestation of the adverse effect first, as that is the patient's primary complaint requiring treatment. Question 20. When coding a patient's admission for severe sepsis, the documentation must include which of the following to be coded as severe? I. Any underlying infection. B. Systemic inflammatory response syndrome, SIRS. C. Associated acute organ dysfunction. D. Positive blood culture. Answer C. Associated acute organ dysfunction. This question assesses the specific clinical criteria required by ICD's 10 cm guidelines for coding severe sepsis. The critical difference between sepsis and severe sepsis is the presence of an associated acute organ dysfunction, e.g., acute renal failure, hepatic failure. Sepsis itself requires an underlying infection and documentation of SIRS, but to assign the severe sepsis code, R65-2, the coder must have documentation of the acute organ failure. For example, if a patient with pneumonia also develops acute kidney injury, the combination indicates severe sepsis. Always verify the presence of acute organ dysfunction in the documentation before assigning a code for severe sepsis. Question 21. A 3-character category code in ICD 10 cm is followed by a dash. What does the dash indicate to the coder? I. The code is valid and complete as is. B. A 4th, 5th, 6th, or 7th character must be added for a valid code. C. The code is to be used as a secondary diagnosis only. D. The code can only be used if there is an excludes one note present. Answer B. A 4th, 5th, 6th, or 7th character must be added for a valid code. This concept tests the fundamental structure and conventions of the ICD 10 cm code set, particularly the mandatory requirement for specificity. The dash is a crucial convention that means the code is incomplete and that further characters are required to achieve a full and valid code. The coder must consult the tabular list to determine how many additional characters are necessary to reach the highest level of specificity. For instance, I-25 is incomplete and requires at least a 4th character to specify the type of chronic ischemic heart disease. Always add the required characters when a dash is present to ensure you have selected a fully specified code. Question 22. A patient undergoes an initial treatment for a crush injury of the right hand. The ICD 10 cm code for the injury will require which 7th character? I. B. B. A. C. S. D. D. Answer B. A. This question tests the correct application of the initial 7th character for an injury code in the ICD 10 cm system. The key phrase, initial treatment, is the clue, meaning the patient is receiving active treatment for the injury for the first time. The 7th character, I, is always appended for the initial encounter, which is used as long as the patient is receiving active treatment for the injury, even if it is seen multiple times. For example, an emergency department visit for the injury or a subsequent surgical procedure for the same injury would still use a. Always use the extension when the patient is under active care for the injury, not just for the first time they are seen. Question 23. A 45-year-old female is found to have essential, primary, hypertension and chronic kidney disease, CKD. Stage 3. How should these two conditions be coded according to ICD 10 cm guidelines? I. Code hypertension first, then CKD stage 3. B. Code CKD stage 3 first, then hypertension. C. Use a combination code for hypertensive chronic kidney disease, stage 3. D. Code both separately with no specific sequencing rule. Answer C. Use a combination code for hypertensive chronic kidney disease, stage 3. The concept here focuses on the mandatory guideline for coding hypertension that is linked to chronic kidney disease. The general rule requires the coder to assume a causal relationship between hypertension and CKD unless the provider explicitly states they are unrelated. Therefore, a combination code from the I-12 category is used, such as I-12-9 with the appropriate N18 code for the stage of CKD. For example, I-12-9 for hypertensive chronic kidney disease, followed by N18-3 for stage 3, is the correct coding practice? Always assume hypertension is the cause of chronic kidney disease and use the combination code unless the documentation explicitly states otherwise. Question 24. A coder needs to report a diagnosis of status post-coronary artery bypass graft, CABG. Which Z code category is most appropriate? I. Z98, other post-surgical status. B. Z95, presence of cardiac and vascular implants and grafts. C. Z94, organ and tissue transplant status. D. Z86, personal history of certain other diseases. Answer B. Z95, presence of cardiac and vascular implants and grafts. This question tests the specific application of Z codes related to the presence of medical devices or grafts. The key phrase, status post-CABG, refers to a procedure that implants vascular grafts, which are a type of functional device. Codes in the Z95 category are designated for the presence of heart and blood vessel-related implants and grafts, such as Z95-1 for the presence of aortocoronary bypass graft. Do not use the general Z98 category. Instead, always select the most specific Z code that clearly defines the type of functional implant or device present in the patient. Question 25. What is the appropriate use of the placeholder character X in ICD's 10 cm coding? I. To represent a non-essential modifier in the code description. B. To fill empty character positions when a code has less than 6 characters but requires a 7th character. C. To denote an unspecified or not documented anatomical site. D. To indicate a code that requires and excludes one note. Answer B. To fill empty character positions when a code has less than 6 characters but requires a 7th character. This question addresses a unique and vital structural convention of ICD's 10 cm coding, which is the use of the placeholder X. The X character is only used to hold a position so that the required 7th character, like a, D, or F, can be properly located. The placeholder is required whenever a code has fewer than 6 characters but needs a 7th character to complete the code structure. For example, a code with 5 characters that requires a 7th character must have an X in the 6th position to push the 7th character to the final spot. Always use the X placeholder to ensure the 7th character is in the correct position for codes that need it. Question 26. When coding for documented 2-degree burns of the patient's entire chest and abdomen, what ICD to 10 cm guideline is the coder applying? I. The classification of burn by depth only. B. The sequencing of multiple burns. C. The rule of 9s for extent of body surface involvement. D. The classification of burns by corrosive substances. Answer C. The rule of 9s for extent of body surface involvement. This question tests the specific guidelines for coding burns, which rely heavily on the total percentage of the body surface affected. The concept is based on the rule of 9s, a standard clinical tool used to estimate the extent of the body area burned, which is required for the T31 category codes. For example, the entire chest and abdomen represent 18% of the total body surface area, TBC. Coders must report the T31 code in addition to the specific burn codes for the depth and site. Always remember to use the T31 category to document the total body surface area, TBC, affected by all burns when coding burns, not just the depth or site. Question 27. When coding a medical record, the instructional note code first under a manifestation code indicates what action is required. I. The manifestation code should be sequenced first. B. The underlying condition must be sequenced as the principal diagnosis. C. An additional external cause code must be used. D. The condition described is not mandatory to code. Answer B. The underlying condition must be sequenced as the principal diagnosis. This question tests the essential ICD-10 CM convention of the code first instructional note. The instruction code first appears under a manifestation code, a secondary condition, and clearly mandates that the underlying etiology, the cause, be sequenced as the principal diagnosis. This is the opposite of how you would read it in plain English, so it is a common point of confusion. For example, chronic kidney disease often has a code first note requiring the underlying cause, such as diabetes or hypertension, to be reported first. When you see code first, always remember you must code the etiology, cause, before the manifestation, effect, to follow the sequencing guideline. Question 28. A patient is being treated for a urinary tract infection, UTI, that is confirmed to be antibiotic-resistant, MRSA, methicillin-resistant Staphylococcus aureus. How should this be coded? I. Code only the UTI. B. Code the UTI first, followed by the specific code for the MRSA infection. C. Code the MRSA infection first, followed by the UTI. D. Code a combination code for UTI due to MRSA. Answer B. Code the UTI first, followed by the specific code for the MRSA infection. This question tests the specific sequencing guideline for infections due to MRSA, which is an important chapter-specific guideline. When an infection is confirmed due to MRSA, the current ICD-10 CM guidelines for bacterial agents causing disease usually instruct the coder to sequence the infection, UTI, and 39.0 first, followed by the code identifying the drug resistance, B95.62 for MRSA, for example, and 39.0 followed by B95.62 correctly documents the site of the infection and the organism's drug-resistant nature. Always sequence the code for the underlying infection before the specific code for MRSA or another drug-resistant organism, unless a combination code already exists. Question 29. In the neoplasm table, what does the column heading CA in situ represent? I. The cancer has spread to distant lymph nodes. B. The cancer is localized and confined to the original site, not invading neighboring tissue. C. The cancer has metastasized to a secondary site. D. The behavior of the neoplasm is uncertain or unknown. Answer B. The cancer is localized and confined to the original site, not invading neighboring tissue. This question tests the understanding of one of the critical terms used in the ICD-10 CM neoplasm table. The term carcinoma in situ describes a condition where malignant cells are present but are strictly limited to the site of origin and have not yet invaded the basement membrane, neighboring tissue. This stage is often referred to as pre-invasive cancer and is coded with a D00, D09 code. For example, a documented carcinoma in situ of the skin indicates a non-invasive, localized malignancy. Remember that in situ is the stage before invasive cancer and must be coded separately from primary malignancy. Question 30. A patient presents for a routine physical examination. The physician addresses the patient's chronic asthma during the visit. What is the correct sequencing of the diagnoses? I. Code the chronic asthma first, followed by the code for the routine physical examination. B. Code only the routine physical examination. C. Code the routine physical examination first, followed by the code for the chronic asthma. D. Code only the chronic asthma. Answer C. Code the routine physical examination first, followed by the code for the chronic asthma. This concept tests the application of ICD-10 CM guidelines for routine examinations when a chronic condition is also addressed. The key is that the primary reason for the encounter is the routine examination, Z000. According to the guideline, the code for the routine examination is sequenced as the principal diagnosis, and then the code for the chronic condition, asthma, J45, is reported as a secondary diagnosis. For example, Z0000 would be the principal code, followed by J45909, as the chronic condition did not require additional work beyond what is included in the exam. Always sequence the Z code for the routine exam first when the exam is the primary reason for the visit, even if chronic issues are managed. Question 31. A patient is diagnosed with uncontrolled type 1 diabetes with ketoacidosis. Which code category is sequenced first? I. E10, type 1 diabetes mellitus. B. E11, type 2 diabetes mellitus. C. E08, diabetes mellitus due to underlying condition. D. R55, syncope and collapse. Answer, I. E10, type 1 diabetes mellitus. This question tests the coder's knowledge of the classification and combination codes for type 1 diabetes and its manifestations. The keywords type 1 diabetes and ketoacidosis are the clues, and ICD's 10th CM provides a combination code within category E10 for type 1 diabetes with ketoacidosis, such as E10-10. Since a combination code exists, it is the only code needed to report both the underlying condition and the manifestation. Combination codes are designed to fully describe two diagnoses that are causally related, thereby simplifying the coding process. Always look for the single, most specific combination code when coding diabetic manifestations like ketoacidosis. Question 32. A provider documents a lump in the left groin. The patient has a history of a chronic disease. The coder finds a specific code for the lump, R2241, and a code for the chronic disease, which is sequenced as the principal diagnosis. I. The chronic disease, as it is historical. B. The code for the lump, as it is the reason for the visit. C. The code that requires the most characters. D. Both codes are of equal importance and can be sequenced in any order. Answer, B. The code for the lump, as it is the reason for the visit. This question tests the fundamental guideline for selecting the principal diagnosis in an outpatient setting, which is based on the reason for the encounter. The key phrase, lump in the left groin, identifies the primary reason the patient is seeking care, making the code for the lump, R2241, the principal diagnosis. Although the chronic disease is documented, it is only a secondary diagnosis if it influences the current care or treatment. For instance, if the provider is primarily evaluating the lump code is principal, regardless of the patient's history. Always sequence the condition or problem chiefly responsible for the services provided as the principal diagnosis. Question 33. Which condition requires the use of two codes, one for the condition and a second for the associated external cause, even in the outpatient setting? I. Strep throat. B. Traumatic fracture. C. Essential hypertension. D. Type 2 diabetes. Answer, B. Traumatic fracture. This concept tests the specific ICD-10 CM guideline regarding the mandatory reporting of external cause codes V, W, X, Y, with an injury code ST. The diagnosis of a traumatic fracture is coded using a code from Chapter 19, which requires an additional external cause code, describing how the injury happened to fully document the event. For example, a patient with a broken arm from a fall would be coded with the fracture code and the external cause code for the fall. Always remember that external cause codes are mandatory to report alongside all injuries, poisonings, and adverse effects to provide a complete picture of the event. Question 34. A newborn is diagnosed with a congenital malformation of the heart. Which chapter of ICD-10 CM should the coder primarily utilize? I. Chapter 7, Diseases of the Circulatory System. B. Chapter 17, Congenital Malformations, Deformations and Chromosomal Abnormalities. C. Chapter 16, Certain Conditions Originating in the Perinatal Period. D. Chapter 18, Symptoms, Signs, and Abnormal Clinical and Laboratory Findings. Answer, B. Chapter 17, Congenital Malformations, Deformations, and Chromosomal Abnormalities. This question assesses the coder's knowledge of the specific chapter classification for conditions present at birth. The keyword congenital malformation is the clue, directing the coder to the Q codes in Chapter 17. The ICD 10-CM system classifies conditions that are present at birth or hereditary in this specific chapter. For example, a newborn with a ventricular septal defect Q210 would be coded from Chapter 17, while an acquired heart condition would be coded from Chapter 9, circulatory. Always code conditions that are documented as congenital, present at birth, from the Q code chapter, regardless of the body system affected. Question 35. When a patient is admitted for a complication of surgical and medical care, e.g., a postoperative infection, and the complication is the reason for the current admission, how is the diagnosis sequenced? I. The complication code, T code, is sequenced first, followed by the nature of the complication. B. The nature of the complication is sequenced first, followed by the complication code, T code. C. Only the nature of the complication is coded. D. The original reason for the surgery is sequenced first. Answer B. The nature of the complication is sequenced first, followed by the complication code, T code. This question tests a key ICD-10-CM guideline for coding complications of care, which requires 2 codes. The rule dictates that the nature of the complication, G, the specific type of infection, the specific hemorrhage, is sequenced as the principal diagnosis because that is the condition being treated. The second code is the T code from the T80-T88 category, which identifies the type of complication related to the procedure or device. For example, if a patient is admitted for an infected surgical wound, the infection code is principal and the T code for the complication is secondary. Always code the nature or manifestation of the complication first when it is the primary reason for the encounter.